Hello, I'm José Luis Cobos, ICN's newly elected president, and on behalf of ICN's board and staff, it's my pleasure to welcome you to our webinar on the vitally important topic of prioritizing nurses' health and well-being. My presidential watchword is empowering and improving the health and well-being of our workers. Nurses is incredibly important to empower our nursing workforce to thrive and to change the world. You may remember that this year's theme for International Nursing Day and the topic of ICN's I&D report is Caring for Nurses Strengthens Economies. We chose this theme because the evidence is clear. When we care for nurses, we care for entire population. Supporting nurses' well-being strengthens health systems, improves patient outcomes, and creates more resilient, productive, and prosperous societies and stronger economies. A thriving nursing workforce is the key to solving our world's biggest global health challenges, from making healthcare accessible and affordable and achieving universal health coverage to addressing challenges like rising chronic diseases, aging populations, growing mental health uses, the health effects of climate change, future pandemics, and protecting healthcare in the rising number of conflicts and crises worldwide. Nurses are the world's largest health profession. We now number 30 million nurses in the Americas, and right across the world are doing incredible work to keep populations healthy and to advance all of our global health goals. However, nurses are often not being cared for sufficiently, and this is worsening our global shortage of nurses and preventing nurses from fulfilling our full potential to transform healthcare. Let me speak in Spanish now. Tenemos pruebas de todo ello y también tenemos las soluciones. Este año se han publicado 3 informes de gran importancia basados en investigaciones que nos proporcionan datos sobre el personal de enfermería y su bienestar. En primer lugar, el segundo informe de la Organización Mundial de la Salud sobre el estado de la enfermería en el mundo, que el CIE copresidió. En segundo lugar, una encuesta a gran escala realizada a los presidentes de las asociaciones nacionales de enfermería del CIE. Y en tercer lugar, el propio informe del Día Internacional de las Enfermeras del CIE. En nuestra encuesta a los presidentes, las asociaciones nacionales de enfermería nos informaron de una brecha creciente y una alarmante entre la demanda cada vez mayor de personal de enfermería y la disminución de la oferta de profesionales. El hecho de no valorar y proteger a los profesionales de enfermería en un momento en el que la demanda de servicios de salud está aumentando, está llevando al personal de enfermería de todo el mundo al límite. El informe sobre el estado de la enfermería en el mundo también reveló preocupaciones importantes y urgentes. Seguimos teniendo una enorme escasez de enfermeras y enfermeros. Aproximadamente faltan 5,8 millones en todo el mundo. Y carecemos de protecciones adecuadas para su seguridad y bienestar. Solo alrededor de la mitad de los países informaron de la existencia de normativas que regulan las horas y las condiciones de trabajo. Y más de la mitad no cuentan con disposiciones para el apoyo a la salud mental y el bienestar. En América, el porcentaje de países que informaron de la existencia de disposiciones de apoyo a la salud mental y el bienestar de las enfermeras y enfermeros se redujo al 31%. Esto debe cambiar. En nuestro informe del Día Internacional de las Enfermeras, demostramos que apoyar su bienestar tiene un enorme impacto positivo. Reduce los costes de la sanidad en materia de daños y enfermedades laborales. Mejora la retención y mejora la seguridad del paciente. Reduce los enormes errores médicos y, en última instancia, construye sistemas de salud y economías sólidos. El CIE también expuso soluciones claras para apoyar el bienestar del personal de enfermería, tanto en nuestro informe como en nuestra Carta para el Cambio. Una lista de medidas políticas que todos los responsables que toman decisiones deben adoptar para proteger y valorar al personal de enfermería, con condiciones de trabajo y una remuneración dignas, para que así les capaciten como líderes. Todos estos documentos e informes están disponibles en el sitio web del CIE y animo a todo el personal de enfermería a que los lean y que los utilicen para promover el cambio. Sabemos que las asociaciones nacionales de enfermeras de toda América están realizando una labor extraordinaria e inspiradora para mejorar el bienestar y el apoyo sanitario de todo el personal de enfermería de la región, de lo que se hablará hoy en este webinar, y que el CIE seguirá colaborando con todas nuestras asociaciones para apoyar, empoderar y capacitar a todo el personal de enfermería. Juntos podemos crear un futuro más saludable para todo el personal de enfermería y las comunidades a las que atendemos. Espero disfruten de este webinar y les envío un abrazo y un cordial saludo para todos ustedes.
Thank you, Jose Luis, for setting the tone. So to build on that, we now turn to Howard Captain, ICN CEO. I know that he is just back from New York attending the UN General Assembly and the high-level meeting on NCDs and mental health. So Howard, thank you for joining us today. I know that you will provide a global perspective on the health and well-being of nurses and also to highlight some of the ICN policy work on this topic. The floor is yours. Thank you.
Hola, saludos, bienvenida, bonjour, welcome. Thank you, Hoi Shan, for your introduction, and welcome to all of you for this really important webinar on the mental health and well-being of nurses. Cyril, please pull up the presentation. I'm just going to take a few minutes to give you a global overview of the key issues that ICN is dealing with and the policy work that we are engaged in. Next slide, Cyril. ICN, of course, needs no introduction to you. You know that we're the global voice of nursing. More than 140 national nursing associations. That's a record high now in membership of ICN. We're just over 125 years old, formally recognized by WHO. The voice of 30 million nurses now around the world. You've heard from our new president, Dr. Jose Luis Cobos Serrano, and you can see him here at Congress with the new board of ICN, and you will be hearing soon for the board member for LATAM from our dear colleague, Nora. Next slide, please. Nurses' mental health and well-being has always been a critical issue, but it came into very sharp focus and global attention as a result of the pandemic. Helen Clark, who spoke at our Congress this year, former Prime Minister of New Zealand, led an inquiry into the impact of the pandemic on our health systems, and she highlighted the impact specifically on nurses. Nurses and our frontline health workers are often not properly protected, going the extra mile for the sick, the dying, doing whatever they could. Helen highlighted the huge physical and mental health toll that the pandemic took on nurses. We at ICN described it as a mass traumatization, but we also said it was very complex. We were seeing nurses, of course, suffering from issues like burnout and anxiety, but right the way through to diagnosable mental health problems. Sadly, tragically, we had some suicides as well of nurses during and following the pandemic. And as you've heard from our president, Dr. Jose Luis Cobos, mental health well-being of nurses is a priority for him, and he highlights as well the insidious impact of having to deal with very traumatic injuries. We see this often in conflict zones where nurses are going from patient to patient, and each patient with a very brutal and deeply traumatizing injury that they are having to treat and care for. Next report, please. Next slide, please. It was because of the pandemic impact that we were seeing on nurses that we said to WHO, we need a second State of the World's Nursing report. Dr. Tedros agreed to it, and this is the report that was released on International Nurses Day this year. It highlighted that there had been a growth in nurses, but the shortage, which Dr. Louise Cobos has already highlighted, of 5.8 million, this huge inequality in distribution of nurses around the world. But these two very startling statistics that, given the pressures, the impacts, 41% of countries did not have measures in place to protect mental health workers from attacks, and 58% of countries had no mental health and well-being support in place. The practical policies are just woefully inadequate and not sufficiently in place in countries right the way around the world. Next slide, please. We also undertook a survey of national nursing associations. Nearly 100 of them responded, and we published this report just before International Nurses Day. We asked about the pressures and demands on nurses that they were seeing. 60 to 66% of our associations saying that since 2021, the pressures on nurses, on health systems, had moderately or greatly increased. And this is significant. We know that the pandemic had a huge impact, but the strain that our health systems are under more generally as they try to rebuild and recover is adding additional pressures. And then this table that you can see, the reds and the greens, show the reporting from national nursing associations about whether they could see that there were policies in place in countries to address issues of violence, support for nurses, psychological and mental health well-being. And these results reflect what was also in the State of the World's Nursing report. And most significantly there, 64 and 69% of associations saying that there weren't measures in place to ensure the right skill mix and right staffing levels. And you can see some of the other very significant statistics highlighting the scale of violence and attacks that there have been on health workers and nurses over the last 2 to 3 years. Next slide, please. What does all of this mean for nurses working in practice every day? The image, the cycle of nurse burnout, you can see on the right-hand side here. If you are exposed to consistently high levels of burnout, it reduces your productivity, your effectiveness at work. We'll see higher levels of sickness and absenteeism. It will create a risk of more medical errors with worse outcomes for patients. We will see increase in staff leaving and higher turnover rates, and that therefore has an impact on the staff that are left behind, adding to the burnout that they are already experiencing. So you can see the interrelationship and the connectedness as well. Next slide, please. What are the causes of harm? What are the risk factors? Not just issues of burnout and fatigue, but long hours, occupational injuries, musculoskeletal injuries, pathogen exposure, but as well as the negative impacts for nurses, the negative impacts for patients. On the right here, the costs on the health care system. mentioned sickness already, but the performance, the productivity, the costs of additional agency or bank staff to cover absenteeism, the very costs of nurse turnover and having to replace staff. So there are very direct impacts for our health systems as well as for nurses and for patients. Next slide, please. And these impacts, as well as having impacts on individuals, they have cost impacts, huge cost impacts. Look at the figures here on the costs of the loss of nursing productivities. These are independent research studies examples, but estimated between 100 and 300 billion dollars, the lost productivity or the productivity that could be gained by investing in nurses' health and well-being. The savings within a country for medical errors, reducing rates of medical errors, could be 606 and 6 million. And if our politicians and policymakers, if they're nervous about investing in health care, they get an immediate win and return. For every dollar invested, the positive return will be equivalent to $2 to $4. There are also examples, very specific examples here of initiatives targeted at supporting nurses' mental health. And again, the cost benefit of doing that. In the Netherlands, 5 to 11 euros benefit for every euro that was invested. Next slide, please. So it's not just a matter of doing the right thing for nurses and for patients, but there are economic benefits. And for these reasons, in 2020, WHO, with the strong support of ICN, set the theme for International Patients Safety Day of nurses' safety and patient safety being the two sides of the same coin. This charter was produced by WHO for Patient Safety Day in 2020. It's available on their website, and it calls for some very specific things in terms of making sure that health worker safety and patient safety are considered together. But it says very specifically that countries should develop, improve, implement national programs for occupational health and safety. There should be protection of health workers from violence in the workplace. We should improve mental health and psychological well-being, protect health workers from physical and biological hazards. But colleagues, we have the same worrying, deeply worrying results when we ask countries, have you adopted and implemented this charter? Last time I asked WHO, only about 20 countries had said that they had formally signed up to this charter. We know what to do. WHO, ICN have been very clear about what policies to adopt, but there is a gap between policy and practice. Next slide, please. But we shouldn't forget that often we're dealing with the symptoms. The burnout, anxiety, mental health, and psychological pressures are symptomatic of root cause problems within our health systems. Shortage leads to inadequate staffing levels and unsafe staffing levels. It is a root cause issue that we should be highlighting. The huge pressure that's on our health systems that means that people have to wait a long time or can't even get access to healthcare whilst they're unwell, in pain, they see their relatives suffering, is another root cause issue. And often the culture of our health systems can be defensive and not transparent and open, can be another root cause issue. Next slide, please. But I've talked a lot about the policy and the data, but we know that there are really great case study examples where practical policies have been put in place. We've made the transition, the step from policy to practice, and it works. Magnet for Europe, you will be aware, many of you, of the Magnet program, inspired by Linda Aitken's work on nursing and safe staffing, a program which focuses on good employment practices, because that acts as a magnet to attract nurses to work in a hospital or into an environment. And look at the figures here from the results of where these magnet hospitals have focused on good working conditions and clinician engagements. Nearly an 18% reduction in burnout, a 14.6 decrease in nurses intending to leave. Hard evidence of impact. An example here from Australia as well, where they have initiated a program to allow peer-led support for nurses. This is important because often health systems are so busy, there isn't time to talk, to support our colleagues. But when you do it, the Australia example shows again positive benefits in terms of nurses' well-being and their retention. Next slide, please, Cyril. There's an example from Switzerland. In Switzerland, the association led and called for a public vote across the country to say our government must prioritize more in nurses education and recognition, but also in the decent work for nurses. A public vote in Switzerland was in favor of prioritizing nursing and nurses' welfare. I think that the Swiss population were ahead of their politicians in recognizing how important the welfare, the well-being of nurses was. And then this example from Japan, which is focused particularly on shift working. We know that shift working can be harmful. We know that there's a 20% increase in the risk of NCDs for nurses who regularly work shifts, have been working shifts for 10 years or more. Practically, what do we need to do? We need time off between shifts. The ILO recommend, I think, 12 hours, weekly rest periods, good annual leave, sick leave provisions as well. There is a convention on nursing that ILO have, the ILO Nursing Convention, and it's number 149 if you're searching for it, the ILO Convention. It very clearly sets out in its articles that regulations on working hours, maximum rest breaks as well, should be part of government's policies for supporting nurses. Next slide, please. In addition to the ILO, we have our global strategic directions for nursing, the global strategy for nursing, first launched, published after the first State of the World's Nursing Report in 2021. Those with sharp eyes will see that the date here for it to finish is this year, 2025. But I hope many of you know that this year's World Health Assembly member states, countries unanimously agreed to extend this strategy through to 2030. And there is a section specifically on jobs, as well as education, leadership, service delivery. Next slide, please. If you drill down into the strategy on jobs, it says these specific things. The pandemic highlighted the gaps in policies to retain midwives and nurses. We need to do more for occupational health to address sickness, death, burnout, and absenteeism. We need to focus on positive enabling work environments. This includes safe staffing, respect, adequate resources, and experienced leaders. The WHO document developed, supported by ICN, the global strategy that health ministers have adopted, makes very clear, they pull no punches, they're very clear and very specific about what we need to do to support nurses' mental health. Next slide, please, and my final slide. And so you've heard from ILO, you've heard from WHO, and this is ICN's Charter for Change, which sets out very simply the 10 key points that need to be taken by countries to support, to strengthen, to invest in the nursing workforce. And you can see there at number 2, urgently address and improve support for nurses' health and well-being by ensuring safe and healthy working conditions. Colleagues, We have the evidence of the scale of the problem. We have the evidence of the impact, not just on nurses, but on patients and on our health systems. But we have the strategies which tell us what to do. And we have the case studies to show that they work in practice. And we have the economic evidence to show that these are economically beneficial things to do. There are no reasons to stand in the way of countries doing more to protect the mental health of nurses and our health workers. Hoi Shan, back to you.
Thank you, Howard, for the comprehensive presentation. Just a kind reminder to all the remaining speaker, because we have a very packed schedule today, please stick to your time of the presentation. Then hopefully we can get to the Q&A answer like the participant question in the Q&A box. Okay, so let us now hear from the ICN board. I'm pleased to invite Laura Barberona de Pinate, ICN board member for Central and South Americas. She will share the update from the Council of the National Nursing Association Representative Policy Forum on Health and Wellbeing. Laura, thank you for joining us today, and I give you the floor.
Thank you so much. Thank you, everyone, for being here today. As a member of the ICN board, I'd like to share with you a few updates and important reflections. As Howard mentioned, the well-being of nurses is a priority for us in ICN and for our board. We cannot face the lack of nurses in the world without tackling the root causes that have led to this situation and that lead nurses to abandon their studies or their jobs because of stress or other inadequate working conditions. Today, we're celebrating this meeting, and I'd like to share with you a few points that we discussed in June in Finland. We worked very hard at ICN and discussed thoroughly how to better protect nurses. We had a workshop on policies that gathered some delegates from our member countries in order to talk about these subjects. The delegates work in groups, focusing on critical subjects such as the workforce and the well-being of nurses. Each group discussed strategies, effective strategies that were being applied in their countries and showing positive results. This was in order to identify the most successful strategies. We also had the participation, a great participation around the discussion on how to protect the mental health and physical health of nurses. We heard many initiatives on national and international initiatives that have been successful by adopting this comprehensive approach, implementing changes in policies and at a national level. Our colleagues, for example, from India and Slovenia, shared their success with structured programs of well-being in their countries, as well as other initiatives to support in a confidential manner that they have been implementing. We also heard about some other programs that include yoga and other exercises for mental health that have shown many different positive results. It was especially important to hear the delegates talk about the positive impact of changes at a political level. For example, the strengthening of some legal practices that they achieved in Estonia, and historical reform implemented in Norway around occupational therapy, occupational injuries suffered by nurses during their practice. And we also heard about the implementation of some good practices for nurses that have shown a very positive impact in their well-being. We also heard about many concrete actions taken to support a more just and fair remuneration for the profession of nursing, including different salary scales and bridging the gap for salaries. It was very clear from our conversations that all of these steps contribute to the well-being of the workforce of nurses in the world. Our workshop ended with concrete recommendations, including the establishment of a pilot program to strengthen the workforce of nurses that would entail putting to the test some new and better working conditions for nurses in the world, and to document all of these learnings in order to put together new strategies that could be applied in other countries as well. In summary, all the participants in the CNR brought clear messages on how to strengthen and improve the well-being, physical and mental well-being of nurses, and how this needs to be a priority for ICN. They emphasized that mental security and safety is as important as physical security for nurses, and the importance of protecting mental health for nurses. All the examples provided by different countries demonstrated that with the proper political will, advocacy, and activism, we can achieve our goals for well-being of all nurses in the world. We are working and presenting webinars in the Americas region to call upon leaders to invest in the nursing profession, because by investing in the profession, we'll see tangible results, not only for our profession and nurses, but also for the populations that benefit from nurses. These are very important reflections that we could gather and that we are trying to implement through this webinar. Thank you very much.
Thank you, Laura. Thank you for your intervention. We know that it's equally important to hear from the next generation of nurses. So I'm delighted to welcome Yuyu Sumiya, representing the Japanese Nursing Association and the ICN Alliance of Students and Early Career Nurses. In her intervention, she will highlight the well-being challenges faced by student nurses and the impact of this issue have on their education and practice. Thank you for joining us today, Yuyu. You have the floor.
Thank you, Hoi-Shan. Good morning, good afternoon, good evening, everyone. My name is Yu Sumiya, and I am a registered nurse working in a pediatric ward of a large hospital in Tokyo with over 500 beds. I also recently completed a master's degree in global health nursing. I am honored to share both the student and early care nurse perspectives on health and well-being, and because of the limited time today, I will focus on 1, well-being challenges for students, 2, challenges for early care nurses, and 3, opportunities for change that I believe are needed in Japan from my experience. First, let me talk about the challenges faced by students. In Japan, as in many countries, nursing education is intense and highly demanding. During clinical placements, students spend long hours caring for patients. Afterward, many stay up late completing required reports and assignments. Even when they are already exhausted from practice, they continue working into the night, which often leads to sleep deprivation and arriving at the hospital the next day completely drained. At the same time, students must prepare for frequent skill tests and national license examination. Some also balance these responsibilities with long commutes or part-time jobs. Faculty and mentors provide guidance, but support often focuses mainly on academic and technical performance rather than emotional well-being. As a result, many students graduate already experiencing stress and fatigue, and they enter the workforce overwhelmed and underprepared for the realities of clinical practice. Next, let me share the challenges I encountered as an early care nurse. The transition from student to practicing nurse is widely recognized as a critical and stressful period. When I began working in a pediatric ward, I was fortunate to be in a hospital with a strong preceptor system, which guided me closely in the early months and gave me confidence. Yet, even in this supportive environment, I faced challenges that affected my well-being. Sometimes patients or their families spoke harshly to me. I often had to study new diseases and treatments late at night just to keep up with my responsibilities. At times, I received critical feedback from senior colleagues and I felt discouraged. In addition, working rotating shift made it difficult to keep a stable rhythm of sleep, meals, and rest. These experiences showed me that even with structured support, psychological safety is not always guaranteed. Data from the 2024 Japanese Nursing Association survey indicated that 8.8% of new graduate nurses leave their jobs within the first year, with mental health issues among the top reasons for resignation. The combination of emotional strain and physical fatigue puts many young nurses at risk of burnout. Finally, I would like to highlight opportunities for change with a focus on the Japanese context. Japan already has a strong educational and mentoring systems. For example, hospitals provide structured training based on years of experience. Since 2010, following the policy recommendation of the Japanese Nursing Association, a legal reform in Japan has made new graduate nurse training a nationally recommended requirement, which has helped hospitals build systematic programs to develop technical skills and knowledge. And thanks to recent ICN reports and statements, the importance of nurses' well-being has finally begun to gain attention in Japan. However, from the viewpoint of students and new graduates, psychological support remains insufficient. I believe that, for example, establishing regular reflection sessions during both clinical training and early employment, giving students and young nurses a safe space to share their feelings, or creating anonymous feedback systems to encourage open and honest communication without fear could help make the transition into practice smoother and support more nurses to remain in the profession. At present, Japan does not yet have a formal mechanism to collect the voices of students or early career nurses. The examples I shared today come from my own individual experience, but I hope that in the future, Japan can establish platforms where students and young nurses exchange views and contribute to their insights to policy dialogues. By supporting nurses from their education through their early practice, we can build a stronger, healthier, and more resilient workforce. Thank you very much. Back to you, Hoi-Shan.
Thank you, Yu. Thank you for bringing the voice of students and early career nurses so powerfully. Next, we move to a country case study, and I would like to invite Felipe Cortes Ledi, and he is the National Director of Nursing in the Ministry of Health in the government of Chile. And he will kindly share insights from a government perspective, particularly on the role of policies and leadership in building supportive environments for nurses. It's great to see you again, Felipe, and I give you the floor.
Thank you so much. It is a pleasure for me to act on behalf of chiefs of government, and I'm going to share my screen with you just to talk about the importance of the politics and leadership to create a favorable working conditions for nurses. As Juju and Howard mentioned, this is very important from an academic point of view. As you heard, I'm from Chile, and Chile is a nation that's very far away from other countries. It is the country that has approximately 20 million inhabitants and over 87,000 registered nurses. And we work in the public network of health. We have a mixed health system. And our training is lasts 5 years. We need to study for 5 years in order to become nurses. And thanks to the government's effort, we have a recognition of our specialties by the state. And now you can see this in the reports of nursing in the country. What about my role? My role is to be a representative, as WHO states, a representative that has a political role, a strategic role, in order to develop nursing not only in terms of policies, but also in promoting well-being for nurses in general. Well-being is a priority for our government. To do that, we have defined several strategic axes in order to do this. And as Jojo mentioned, professional training is extremely important. Undergraduate and postgraduate. We also work on care management, which is a very important ability for nurses. We also work on supporting the authorities and to have a voice to foster public policies and in the intersectorial articulation of efforts. This is how we relate to other networks, because geographically we have a very long country. It's an extensive territory, so we need to try to create links to articulate efforts at a national level. In terms of professional training, I had the honor to be part of the ICN Congress in June, and we all agreed that we have a crisis. And we need to work on our capacities. We also need to promote the well-being in general as among nurses, and we need to prepare our nurses to face the day-to-day activities. Their specialties of nursing are also very important, because we also have many programs, and in the state of Chile has recognized formally the nursing profession with a specialty on oncology and mental health.
We also have in Chile a voluntary nursing exam, which should be taken by people who are about to leave the university. We're promoting this exam to become compulsory to assess the quality of the education and to assess the quality of our professional. With regards to the care management, we have a national network from south to north with focal people around the 29 territories in terms of healthcare. It was very important here with regards to what Howard mentioned in terms of leadership. Also, our president, Luis Cobos, mentioned the importance of leadership, how important is to really give this leadership. We work with the federations, with the academia, and with the scientific societies. In Chile are more than 50. Also, we advise the authorities in different aspects related with the well-being of nurses, the humanization of healthcare, which is an emerging area in Chile, inspired in models like the humane plans in Spain, in Brazil, in Colombia, which have to do with a set of rules linked to the healthcare professionals and nurses, like the good treatment, the prevention of attack and harassment. And it has two main points: one within the health care professional teams, and towards the users, like a core responsibility in care. We launched a first national survey of nurses, which is very much aligned with the results of the SOWN and the International Nursing Day report, and we have these active political dialogues on nursing in terms of competencies about, among other topics, which also favors to have this alignment with the authority, and also this has allowed us to have also more resources from the Ministry of Health to ratify the Convention 149 of ILO, which has to do with the working conditions for nurses. And finally, the intersectorial articulation, which has to do with the strengthening of our voice. I am just a bridge, really, which allows that the rest of our workforce has also their voice and their participation engagement for the healthcare policies and the strategies are very important. And also, not only at the national level, but also international level. I had the huge honor of wrapping up the ICN Congress. I'm also known by everybody as the happy nurse because I have done many studies and research on happiness. But I was there in Finland and also in other places around the world. I've been in touch with other government chief nurses, and also with regards to the challenges, the well-being is the main axis of our development. We need to seek for a more transforming leadership with a systemic, individual and systemic organizational vision with regards to the collaborative teams and systematic in time. As I mentioned, nursing in all the policies in the context of the 2030 agenda. These are huge challenges, but we are very enthusiastic from Chile and also coordinating ourselves with the rest of the Americas. I'm always at your disposal to collaborate in everything you may need. Thank you so much. And I'm here if you have any questions for me. Thank you.
Thank you, Felipe, for those very, very valuable insight and also, of course, bringing your energy into this conversation. Excellent. So now we move to Ecuador, and I have the pleasure to invite Maria de Lourdes Velasco, the president of Ecuadorian Federations of Nurses, who will present a case study showcasing how their association is driving initiative to strengthen nurses' health and well-being. Thank you, Maria, for joining us. I give you the floor.
Good morning, good morning, good afternoon, good evening to all of you. First of all, I would like to wish you from this half of the world my greetings to all the nurses of the world who are connected with us in this webinar. Also, it is a great pleasure for me to share this webinar with so many distinguished professionals who had spoken before me, showing the situation of the nurses in the world from the point of view of well-being and mental health. Now, I am pleased to share with you, and I would like to show the first slide, please, Cyril. First slide. Okay, perfect. So I was telling you that the trend, as you can see in the slide, was a very important increase in of mental health appointments by nurses. Next one, please. Next slide. In the specific case of the nurses, we managed to have some studies which gave us scientific evidences, like, for example, the one done by Ramirez in 2017, where we found the trend to the increase of the burnout syndromes in the nurses of the comprehensive public healthcare system. You can see here we have important evidences here in the figures shown in the presence of the burnout in a low level and a high level, and this for us was the reason why we were really alarmed. Next slide, please. Similarly, in the study on the social demographic and workplace study done by the Ecuadorian Federation of Nurses, we also found some alarming data. I'm going to share with you just a few of them. For example, when we asked about the adequate salary, a high percentage, especially in the area of the mountain, they answered that it was a very inadequate salary, and this trend was also kept in the eastern region and also in the coastal region of the country with very important figures. Next slide, please. Similarly, we found in this same study, when we asked the nurses, do you have little interest or pleasure in doing things? A high percentage of nurses answered that they don't really have much interest or pleasure in doing things, and they have this feeling that very often, which also gave us a very high percentage of nurses answering this. When we wanted to know if they felt lack of self-esteem or this feeling of being a failure or disappointment, also the answers gave us a high amount of nurses answering that we were really facing a very challenging situation with the mental health issues and the well-being of nurses. When we asked them if they had been diagnosed with any chronic disease. Also, as you can see here in the graph, from the biological point of view, this showed us a very alarming situation. Here we have a very high percentage of nurses have some cardiorespiratory systems, also some musculoskeletal issues and gastrointestinal issues. And we have other problems that we didn't include in the slide, but these are the most important ones. Next one, please. So with this baseline situation that we were able to show, we decided to establish a justification precisely to be able to get to our main program. First, we have to consider that health is a fundamental right of population. It is within the Ecuadorian constitution. As I told you, we have 25,100 nurses in 2022 who play a very important role in the healthcare system. They should have access to strategies of promoting prevention and care for the psycho-emotional well-being. This also will allow us to detect early on the mental health issues, like, for example, group psychological support spaces and strategies of coping and recovery after COVID, because we haven't done anything with regards to the support of nurses and their mental health after COVID. Also, self-care as a key responsibility is something we want to rescue from the theory of nurses and also the public policies, including the emotional well-being of nurses as the main topic, because at the moment we cannot see in the public policies the emotional well-being of healthcare professionals and especially of the nurses as a special topic. I really admired what our colleague Cortez has shared with us, and I really have a healthy jealousy of Chile, because they do have a national chief nurse at the ministry, because as a country we used to have this figure. Here in Ecuador, due to some political aspect, they removed this position. We are fighting again to have this figure, this position of chief nurse at the Ministry of Health here in Ecuador. Next one, please. Next slide, please. Next slide. Thank you. So this is how we got to the main aspect here, which is the intervention. We believe it is important to get to know the issues, but maybe more important than that is to really to do something to change, to transform this challenging situation. this family and community-oriented integrative mental health self-care program, the Ecuadorian experience. So the goal is to improve the efficiency, the quality, and the sustainability of the healthcare system through the strengthening of the nurses' mental health. And I would like to include here the idea of ICN President Dr. Jose Luis. He says, when we care for the nurses, we also care for the families and the communities. That is the approach we wanted to give to this mental health program. So the purpose really is to improve the self-care of this family and community-oriented integrative mental health self-care program, ensuring a healthy and a sustainable working environment. Next slide, please. So which are the components of this integrative mental health self-care program? The first component is the encouragement of self-care for mental health and healthy habits. Through different strategies, we are going to ensure this encouragement of self-care of mental health through the mapping of the personalized mental well-being. No, please, could you please go back to the previous slide? Yeah, thank you. As I was saying, so we have the different strategies here, like the creation of a personalized self-care map. The second component is a continuous training through different activities and actions and interventions, like, for example, awareness raising and motivational talks. We have also active workshops, the training of leaders in emotional well-being, spaces for clinical supervision and emotional well-being. Next slide, please. We have a third component which has to do with the emotional regulation, and similarly here we work the emotional intelligence workshops. We also have the emotional and diary exercises and other strategies which are the ones who are going to help us to reach the expected results of this program. Fourthly, we have the psychological intervention. You will need to take into account that not everything boils down to the prevention of mental health issues. We do have already some pathological issues and conditions which have to be tackled specifically. So we have also thought about the psychological intervention using, for example, some individual psychological therapy, also group-based psychological therapy, also the clinical referral systems to also meet these requirements and needs of the nurses and from other healthcare professionals. Next slide, please. Okay, with the workplace climate, we have, as I mentioned a few minutes ago, so we have the basically the acceptance that if the organizational structure has well-being, this well-being will become a favorable and positive aspect for this healthy workplace, and also it will have a positive impact in the well-being of the healthcare professionals. As the expected results, we want at least 70% of our nurses of the public healthcare system will be benefit a better quality of life, better emotional well-being, the reduction the work absenteeism, also prevention of burnout, and also a better safety for patients and users who are going to be cared for by staff with less stress and less burnout. And the last slide, please. The last slide. And here we have the lessons learned with this program. As a lesson learned, we have the interdisciplinary work by Fedi and Cathars, which is a key strategy for the program. Also, we have interinstitutional strategic alliances and the motivation of the nurses. It is really a very important aspect for development the program. And as a challenge, we have to ensure to secure financial support to project this program regionally, internationally, and to share the experience with other nurses and healthcare professionals. And the last one, please, last slide. The impacts of the change, expect to strengthen the interpersonal relationship among their peers and into the different disciplines to improve the relationship between the healthcare professionals within the users and the patients and the public healthcare policies that include the emotional well-being of the nurses so that the mental health interventions will be sustainable throughout time, will be integrated in the healthcare system structure. Thank you so much, and I'm so sorry for extending my time.
Thank you, Maria de Lourdes. My apologies for the technical difficulty, and thank you for giving this excellent presentation. So in order to broaden the lens, we now turn to a regional perspective. So I would like to give the floor to Maria Concepcion Chavez, the president of the Pan American Federation of Nursing Professionals. So she will share reflections on how well-being issue resonates across the Latin American region. The floor is yours. Thank you for joining us today.
Good morning, good afternoon, good evening to all the nurses from the region of Latin America and the Caribbean. On behalf of the 20 countries from Latin America and the Caribbean, I'd like to greet you today. And I'd like to express my gratitude and my congratulations to the International Council of Nurses for organizing this important webinar, and Jose Luis Cobos for presiding this association, and our representative, Nora Barahona. I'd like to thank you and greet you all. I'd like to congratulate those who spoke before me. Now, I'd like to talk about the well-being of nurses in the region, in all the health systems in the world. This is a very difficult situation right now, and luckily, today the WHO and ICN and our federation, the Pan American Federation of Nurses, is tackling this subject as an urgent one. We are working hard on it. So what have we done so far in the region of Latin America and FEPEN, my organization? I have been presiding this organization for a few years now, and I'd like to share with you what we have done. I have visited over 10 countries in the region. And today we want to put health and well-being first. We want to make it a priority for nurses. This is a commitment, not only for nurses, but to all governments as well. And of course, for all the international organizations of nurses, not just for nursing associations, but for the ILO, the United Nations, and other international organizations, because we are working together to sustain our health systems. The documents and the reports show that nurses are a pillar for the health systems in the region. As Howard Cotton said, and the president of ICN said, the situation of nurses needs to be a priority. I've participated with 13 presidents and representatives of Latin America in many forums, and we agree that the lack of staff is very difficult. It's a very difficult challenge because we face low salaries and a lack of legislation. We face precarious working conditions as nurses, as we've said in these webinars, and all of that brings about consequences that worsen stress, fatigue, and mental health issues. And also with the advances in artificial intelligence and other technologies, we need to be ready to face all of these challenges. We also have an aging nursing population. We are changing generations, and we are seeing many retirements and we need to be ready for all of that in Latin America. Next slide, please. Latin America is facing all of these challenges today due to the demographic changes, due to the environmental catastrophes. And this is happening not only in Latin America, but in Central America as well. But none of our countries is exempt of this situation. Countries are also facing the problem of the excess of political power generated in several regions of the world, which does not come with economic measures and political measures or social measures that can help the population and nurses. Nurses are not separated from the rest of the population. We have the same rights, and we need safe and proper working conditions. We need, therefore, to promote decent work conditions. And all organizations need to talk about this all over the world. In the region, we need to talk about how nurses need the support from the governments. We need the governments and decision makers to promote the good conditions for this good working conditions. In FEPEN, we also talk about protecting the emotional and mental health of nurses, which is urgent. It's something that we need to do to protect the well-being and the mental health of our nurses. Today in FEPEN, in our Pan American Association of Nurses, we are working in order to improve the situation in Latin America. We have seen how we have many leaders. We have many leaders, nurses dedicated to science, to diagnostics, dedicated to professional training. We have many leaders. And we also heard a student from Japan who shared with us the situation that students face. And I don't think Latin America is that different from Japan. So we have started a very interesting project called Uniting the Leaders in Latin America and the Caribbean. For that project, we have carried out some workshops and courses to incorporate public policies that guarantee better conditions and better salaries. So we can not only lead the management of nurses, but also promote their health. We want nurses to have a decision-making position. For many years and decades, we have called upon the improvement of working conditions for nurses and to improve the health of the communities and the population in Latin America. Today, we're facing war. We are facing several problems with mental health, not only in our profession, but the post-pandemic populations. So we wanted to gather all the leaders in our region, and we wanted to form teams so that the teams could have an advocacy role in policies, not only health policies, but also economic ones and world politics. And that's why, dear colleagues, we have worked together with ICN we have worked together with several organizations in order to carry out this work so that we could unite all the leaders from the entire continent and the world to work together to change the reality, this horrible reality that many nurses face. When we talk about leadership and when we talk about our reality, we're talking about our nurses, our populations, and the cry for help that all human beings are doing today, because we believe that all our practices will affect not only our nurses, but also all the populations and the entire continent. The Pan American Federation of Professional Nurses calls upon all governments to give priority to the well-being and health of all nurses, which is not just an act of justice, but it's also a very smart strategy to guarantee solid and equitable health systems. I'd like to thank ICN again and remind you that our next International Congress will be in Rio de Janeiro, Brazil in November. And we hope to discuss all these subjects during this event. And we'll talk about the power of nurses to change the world and the power of nurses to change the continent. Let's unite all our leaderships, all our leaders, so that we can make a real change. Thank you very much for giving me the opportunity to talk about this subject. Thank you very much.
Thank you so much, Maria Concepcion, for the regional perspective. So I see we are running out of time. I will now pass the floor to our last speaker. So I would like to welcome Christine Papico, Senior Director of Pathway to Excellence and Wellbeing at the American Nurse Association. So thank you for joining us today. I know you will give us an overview of the evidence-based frameworks for creating positive practice environments and on how to improve the healthful workforce well-being. Thank you for joining us today, Christine. The floor is yours. Thank you, Christine, for highlighting those practical approaches. I see that in the chat box and also in the Q&A session, actually a lot of nurses are asking actually what they can do to improve the health and well-being of nurses. And I think your documents and the information that you just highlighted are very practical to them. And I just want to say thank you for highlighting that in your presentation. So thank you to all our speakers and participants for such a rich exchange of ideas. Unfortunately, we're already up to the hours. We cannot get to the Q&A session. That's unfortunate. But before I give the floor to our last speakers, I just want to remind the participant who would like to receive ICNIC credit after the webinar, please don't forget to complete the evaluation form and claim your credit. And the link to the survey is now in the chat box. And also you will be able to find all the documents mentioned today from all the speakers, from Howard, from Felipe, from Christine, on the ICN page. So to close the session, I'm very pleased to hand over again once more to Howard, our CEO, for his concluding remarks and a call to action. Howard, over to you.
Let me, on behalf of all of us, give a huge thank you to all of the speakers. I thought all of the presentations were absolutely excellent. You, Felipe, Maria, Christine, thank you so much for just such rich and powerful and thoughtful presentations. I was struck firstly by the fact that so many of the issues we share, they're similar, perhaps not exactly the same, but very, very similar. But we have really powerful evidence, whether that be research evidence or whether it be case studies. We know what works and we know what doesn't work. Plus, we have a global strategy. We have the ILO document. We have the WHO safety charter. We have frameworks in many, many countries as well. So we have the case studies, we have the evidence, we have the charters, but we're missing that implementation piece. And I think I heard Felipe and I think I heard Maria and Christine all talk about how important leadership is, nursing leadership. And colleagues, that's us. It's down to us to take the evidence, to take the case studies, and to advocate and to lead on behalf of the profession. But also, I thought, as well as the leadership around policy and advocacy, the leadership around setting the culture, setting the tone, setting the environment within a healthcare setting is a crucial part of what we do as leaders. All the things that Christine spoke about in terms of feeling that your voice is heard, that you're respected, that there's the opportunity for feedback. And there was a point that I was struck by you as well, who said something about, look, having structured support is not enough. Sometimes the policy doesn't hit the mark. Sometimes we just need to be human, be people, be kind to each other as well. And that's something that we shouldn't miss, I think, which is at the heart of this issue of mental health well-being as well. Look, we know that if we get this right, we deliver on the rights and the respects of nurses, we improve patient safety and quality. It's good for our economies, it's good for global health as well. So let's go out there and advocate and be champions for ourselves, for our profession, for our patients, for the world, colleagues. Thank you. Back to you, Maria, Hoishan.
Thank you, Howard. So this concludes our webinar. So on behalf of the International Council of Nurses, thank you again for joining us today and for your commitment to advancing the health and well-being of nurses everywhere. We wish you all the best and look forward to continuing this vital conversation together. Thank you to all the speakers here. Thank you to all the nurses around the world. Bye-bye.